to tell the truth, delivering bad news to patients.
I tell you, Doc, I can't wait to step onto that ship. I've been working so darn hard my whole life, and boy, do I feel like I deserve this cruise. We're going all out, right, honey? Marsha here, she's my angel, and we finally get to spend an entire month together stress-free. Can you believe it, sweetheart? We've been planning this trip for almost a year.
John, it certainly sounds like you deserve this trip. How's retirement treating you?
Retirement has been great. I'm loving the extra time that I get to spend with my new grandkids. No more managing people, dealing with angry customers, worrying about inventory, getting stressed out about costs. One thing, Doc, if you could just straighten out this pain in my stomach, I'll forever be grateful.
Okay, John, we'll take a look. John, we need to do some further testing to evaluate this blood in your stool. When do you leave for your cruise?
Doc, I'm heading out in 10 days. Can we do the test before then? I don't want anything to be hanging over my head during the cruise.
Bill, it's Jim Quaid. I just finished up with your patient, John Davidson. He's still pretty groggy, and I haven't told him anything yet, but he has a pretty good-sized colon polyp that I took off. I don't have the pathology report yet, but I'm guessing it's cancer. How do you want me to handle this?
The doctors are facing several ethical issues within this dilemma. Should they consider this like if it was a life or death situation? Do they have the right to stop the patient from going on the cruise if it was? Or should they wait on their thoughts until they have the actual pathology report? And should they lead the patient on towards informative consent? All of these ethical issues will be considered using ethical models, which will help determine the best approach to take in this case.
The three ethical models represented in our paper are the rights approach, the virtue approach, and the utilitarian approach. The rights approach states that the ethical action is the one that best protects and respects the moral rights of those affected. Dr. Miller should respect his patient and let him know about his current conditions, because this is what best protects and respects the moral rights of those affected. The virtue approach states that the ethical actions should be consistent with certain ideal virtues that provide the full development of our humanity, while asking the question, what kind of person will I become if I do this? What type of physician would Dr. Miller be if he didn't inform John? The virtue approach reflects the person, not the action. So, for example, honesty, loyalty, compassion, patience, kindness, etc. The utilitarian approach states that the ethical action is the one that provides the most good or does the least harm, producing the greatest balance of good over harm. John's life weighs more than a cruise ship vacation, and the doctor's focus should be what would do the most good and the least harm. The two ADA codes of conduct represented in our paper are autonomy and veracity. Autonomy. The obligation of the doctor is to include the patient in treatment decisions in a meaningful way, with due consideration being given to the patient's needs, desires, and abilities, and safeguarding the patient's privacy. The patient needs could be that he must know the minute information that the gastroenterologist has at the moment. The patient's desire is to enjoy his cruise that is approaching. Veracity. The doctor has a duty to communicate truthfully. This code of conduct states that the doctor has a duty to be honest and trustworthy when dealing with people. Dr. Miller has a duty to respect the trust of the doctor-patient relationship. He must provide the pathology report to the patient, but Dr. Miller does not want to speak too soon. What if Dr. Miller tells John that he and Dr. Quaid suspects that he has cancer, and he goes on his cruise saddened by this news, only to come back to hear that he actually does not have cancer?
So what would you do in this situation?
As student doctors who understand the definition of an ethical dilemma in conjunction with ethical models in the ADA Code of Conduct, a sound ethical decision would be to tell the patient John of his potential cancer diagnosis because the value of his life outweighs the temporary satisfaction of a vacation.